kidney toxicity, which is also called as nephrotoxicity. So, we are going through this part that some chemicals cause an acute injury and other produce chronic renal changes that may lead to end stage renal failure and renal malignancies. So, it means there are some chemicals which causes acute toxicity and some chemicals causes chronic kidney toxicity, but they both may lead to end stage renal failure and renal malignancies. Malignancies means even kidney cancer they can cause. So it is important to study about this kidney diseases because even end stage renal failure is in this condition it is required to replace the kidney with the newer one because it can no longer function well. So it is very important to understand the renal pathologies involving both acute and chronic injuries. So, which are the chemicals responsible for causing these conditions? This includes those neuropathies caused by cadmium, other environmental metals, and more recently, the organometallic compounds used as therapeutic agents, anti-cancer drugs, cyclosporine, analgesic abuse, and antibiotics. So, like, but this is the general classification. You should know the specific compounds which affects the kidney, like for example cadmium, cyclosporine. But in anti-cancer drugs, which chemicals cause damage? In analgesics, which are the analgesic drugs which causes kidney damage, that you should know. Further, organometallic compounds, which are they and how they cause toxicity. And so they cause nephropathies because this nephropathy is the term is related with the kidney diseases. So there can be various kidney problems. Kidney safety assessment in preclinical species is mandatory in novel drug or chemical development. Drug induced nephrotoxicity is one of the reasons for the failure of selection of candidate to next level of its testing. So, for the any new chemical or drug, it is very important to assess the kidney safety because when these drugs go to the next level of their clinical development, there are chances to get failed. These drugs can get failed or cannot go longer to the next level of its testing. So you give me the examples which are the drugs which are might be withdrawn from the market or which cannot go in the further stages of clinical trials because of their nephrotoxicity. Although there is a substantial capacity within the kidney for repair, there are also several circumstances where damage may be irreversible. It means kidney has in it its intrinsic ability to repair or rejuvenate, but at several times these damages can be irreversible. So this kidney because so there are what are the cellular processes which are responsible for this you should know. In general, the proximal and distal tubules and urothelia can be repaired, but the glomeruli and medulla may have a significantly lower repair facility. So, those organs or those structure of the kidney which cannot or lower repair facility is glomeruli and medulla, but the proximal and distal tubules and urothelia can easily get repaired. There are well over 20 morphologically different cell types in the kidney. So these different 20 different cell types which are different in terms of their morphology like size, shape and all, these can be responsible because they might have some characteristics which makes them different. The characteristics of a cell may make it either resistant or sensitive to the target selective toxicity of a chemical. So there are 20 different cells, around 20 different cells, and their characteristics may make it either sensitive or resistant to the toxicity